My name is Hannah Bednar, and I'm the director of Texas START, and it's my honor to present this poster to you today. Over the last several months, there have obviously been many changes related to service delivery due to the COVID-19 pandemic. At the onset of this study, a comprehensive review of the literature was conducted to see what challenges the changes of COVID-19 and social isolation might contribute to in the people we support. One of the tasks our program was faced with was to close the resource center due to positive cases and relocate staff. As a result, our agency decided the best way to utilize this highly skilled team was to support the intermediate care facilities, or ICFs. Anecdotally, due to what we saw in the literature, taking START to the group homes seemed like a great alternative. The hope was that this would increase capacity in the ICF system by introducing positive psychology approaches and reducing the strain on other staff. Our hypothesis was that those group homes with START involvement would have fewer crisis events than those who did not have START staff engaged in their home. As you can see here in the design section, we utilized a pre-post design with a control group. The intervention group consisted of 3 ICFs in which the Resource Center team spent more than 4,000 hours. As the control, data from incident reports of the other 8 ICFs operated by our agency was used. In addition to this quantitative data, a very brief qualitative study was conducted with the staff in the homes in which START was present. The results of both efforts are presented in the outcomes section. As you can see, the 3 months directly preceding the pandemic, December to March, were compared to the first 3 months, March to June, and the 3 months following, June to September. Resource Center staff were embedded in the ICFs during the second quarter, March to June. It is evident that there is a decrease in the average number of critical incidents during the time in which our staff were in the homes. However, it did not rise to the level of a clinically significant difference. Our hope would be to see a continual downward trend in the intervention group. However, as you can see, there was an increase in incidents after our staff left the homes. Also of note is the fact that both the control and intervention groups follow a similar trajectory. There may be several reasons for this, some of which are presented in the limitations and lessons learned section. Most notably, due to the research being begun during the pandemic, there was very little lead time to develop protocols and to make this research more structured. In the future, we would love to be able to conduct similar research when there are less potential confounds like a global pandemic, and utilize pre-post assessments like the AQOL, which measures quality of life, or the ABC.